All right, so on the first leg of the program today, we're talking all things health. And this time around, I want to pay attention to headaches because a lot of times we hear people say, well, I have headache. And when you ask them, what is the reason? They say, I'm stressed up. It's just because of stress. I have some headache here. So this morning we're asking headaches when it's more than just a pain. My guest will be able to shed light on this. Let me bring her right away to the microphone. She's no stranger here. Dr. Adedunni Olusanya is a consultant neurologist and the head of Department Internal Medicine for RJOLAD Hospital. Doctor, nice to have you back in the building. Good morning.
Good morning. Thank you.
Great. So we're talking headache this morning, and that's a common pain that a lot of people have in Nigeria. Is that correct?
Yes.
So when is headache more than just a pain? Talk to me.
Okay. So like he mentioned earlier, headaches are common. Almost all of us have had headaches at one time or the other. It refers to the pain you have on your head, around the face, and it could be due to a problem with the muscle, the skin, the brain, the bone itself. It's a spectrum. Some people say it is aching, some say it is throbbing, and some have unusual descriptions like burning, peppery, heaviness. In fact, some people come to my office and say they have burning, heaviness on their head, and I'm like, you have headaches? They will say, no, it is not headaches, but what I'm just trying to say,
burning sensation in the head.
Yes, it's regarded as headaches in a way. So they are all symptoms that suggest that someone has headaches.
And something is happening, right?
Yes, please.
So do we have anything that is harmless headache?
Well, all of us have headaches, like I said. So some people, when they are hungry, stressed out, when they've not slept well, they could have headaches. And usually some of these things are self-limiting. It goes on its own. But sometimes it is more than just something we can ignore. Like an instance of someone who was well this moment and suddenly he has this terrible headaches that he has never experienced in his life, the worst headaches ever. That could be regarded as something that is just a sinister thing, not just a straightforward minor headache that we present, that most people have. Okay. So for such, you want them to come to the hospital so that they can be fully assessed. That could be due to a stroke, it could be a blood vessel rupturing in their brain, and that needs to be taken seriously.
So for you doctors, how do you classify headaches?
Okay, so we classify headaches generally as primary headaches and secondary. Primary headache is the headaches that is not attributable to a particular illness. Like we talk about things like tension headaches, migraine headaches. I'm sure we can all relate with tension and migraine headaches. Then we can talk about secondary headaches that occur secondary to an underlying disease process, like when someone has headaches from malaria. Okay. Something like meningitis, something like a brain tumor, when headaches occur from a stroke, and all those spectrum of
right.
Sorry.
Yeah, I understand.
So all those diseases, you call that secondary headaches, and your approach to the two differs. Okay. Sorry, my voice is...
Yes, we do understand. So what are the differences? I mean, one is it to say that one just goes on forever or goes on consistently, and the other just comes once in a while and it goes back, once in a while and goes back? Or what's the major difference? Okay,
so for the primary headaches, like I'm saying, tension type headache is what most of us have, the one that is related to stress, not sleeping well, lifestyle and all of that. That you need to treat either of them, but the truth is, for the secondary kind of headaches, you need to remove the underlying cause. So if it is due to an infection, if you treat the infection, the headache is expected to go. For the one that is secondary due to a brain tumor, that has to go. If it is due to a stroke, you treat the underlying symptoms and you expect the headache to disappear. The other primary headaches, you give drugs primarily to address the headache, or you adopt changes in lifestyle to address the headache. So that's the main difference when you talk about the treatment.
Right. So explain to my listener then, because a lot of times you hear people say migraine. So what kind of headache is a migraine? Okay,
so migraine is one of the primary headaches. We know that for some reasons we think, yes, maybe genes, because we've had stories of my mom had migraine, my sisters had migraine headaches, and now I'm having. So it could be due to a genetic issue, but we know that people who have migraine, like I said, a primary form of headache, have other there are so many things that will make the attack worse. So maybe if they're not sleeping well, if they're not eating well, sometimes when they eat particular meals, when they take particular drinks, when they are hungry, when they are tired, and of course if there's an intercurrent illness like malaria, it makes the headache really bad. So you talk about migraine. When someone comes with headaches that is usually on one side, either the right or left, typically throbbing, lasting for a few hours during the day, and it is associated with things like nausea, vomiting, and light and noise, seems to make the headache worse. So you can say someone has a migraine based on this diagnostic.
Okay. All right. So we've known the reasons why people have this kind of headaches. The triggers, you said, could be underlying conditions, right?
Yes, please. Like not sleeping well, not resting, going hungry, extreme pressure, sometimes continuous exposure to light, bright light, noise, and all of those can precipitate an attack of migraine.
All right. Okay then. So, but what about, okay, anyway, you talk about that treatment of other kind of disease. Can cancer treatment lead to headaches as well?
Okay, so one of the adverse effects of most drugs is headache. So when we are talking in pharmacology, headaches, vomiting, nausea, diarrhea, so quite a number of drugs. It's very common. Yes, quite a number of drugs will cause that, including cancer chemotherapy. But cancer itself too can cause headaches if it moves to the brain, and sometimes in instances of some chemicals being released as a result of the cancer. So that could be associated with headaches too. So
if you are asking your patient any of those questions, probably you're treating for something and he's not telling you that he has any headache, should I give you a cause to worry as a doctor?
Sorry, I didn't get that.
If your patient, perhaps you're asking him some of the signs that he or she is experiencing, and the patient says, I don't have a headache, would you be worried as a doctor?
No, I won't. I'll just try to take the patient holistically. What is the problem? Do I expect headaches in this kind of condition? Don't I expect, if I expect the patient to have headaches with the presentation and is not having headaches, I might want to look a little bit further.
Okay. So headaches are curable, right?
So some headaches are curable. Like if headache is from malaria, cure the malaria, then the headache is gone. But when you have instances of migraine headaches are there, the patient could actually get better, treatable, because it comes and goes. So usually we don't use curable for things that could reoccur.
So it's treatable.
It is treatable.
All right. So how do we prevent it now? So what are the prevention techniques? Okay,
so I'll just generalize. For people with primary headaches disorder, like I said, not attributable to a primary disease, but we know that when people are not living a healthy lifestyle, so we advocate lifestyle changes strongly for people who have tendencies to have headaches, like what I've said, sleeping well, eating at the right time, resting well, people who have a tendency to avoid undue exposure to light, and exercise has been shown to improve headaches. Things like yoga, meditation too have been shown to improve headaches in people who have a serious or continuous tension type headache. You call them chronic tension type headaches.
Okay, so sleeping well, because that's something that we need to really pay attention to. It appears people really sleep well these days, right?
Yes, all of us are trying to make money.
All right, Dr. Adedunni, stress-induced kind of headaches. How can we deal with it?
So, like we said, healthy lifestyle, and sometimes some people might have to see a psychotherapist to modify their behavior. Cognitive behavioral therapy might be important for people who have continuous stress-related headaches. If after taking the necessary precautions, they are still stressed out, not resting well, and some of them might need psychological support.
Just psychological support, that's all.
So for yes, mainly, but for people like all the primary headaches, migraine, tension type headache, cluster headache, and even the secondary headaches, sometimes they need not sometimes. They need to see the neurologist to help to make a diagnosis, investigate appropriately, and plan a treatment pathway for them.
Because that's always an issue when we talk about headaches. It's the most common, like, if I could put it that way. And I'm just looking for the way to put some figures to it, Dr. Adedunni.
Yes, I would say maybe 98% of us have had headaches at one time or the other. And I should mention, there are people that come to my clinic that they've been having headaches for 6 years. And I'm like, what have you been doing all along?
For 6 years?
Some more than. So
wow.
The on and off, almost every day. And then you ask what has been done about it. Okay, I've been treating malaria, treating typhoid. You hear a lot of that. Treating typhoid on and off for 6 years and people are not bothered.
Right.
Then they are seeing a neurologist for the first time in 6 to 10 years. It's not very encouraging.
That's right. I will find out what RJOLAD is doing about that. But I'm having some messages that are coming in here for you, Doctor.
Okay.
This one says, good morning. I am Kemi from Ogba. I get headaches almost every day. Should I be worried, or is that just a stress?
So having headaches almost every day is a flag. You need to be reviewed properly and be treated. It could be tension headaches, it could be migraine. But when you come in to see the neurologist, that can be sorted out and we can plan a way forward. It is not accepted as normal to have headaches every day.
All right. Okay, there's one here. It says, good morning, Victor. Sometimes, just like this morning, I woke up with headache. What could be wrong with me? Sheun Ibrahim is sending this one in. Thank you so much, Sheun.
Okay, thank you, Sheun, for the question. Can you come in to see me? I might be able to answer that question properly if I see you.
All right, Sheun Ibrahim. Of course, we'll let you in on the details and how you can get to RJOLAD. Another one here says, good morning. My name is Tosin from Agege. It says, can using phones or screens too much cause constant headaches?
Yes, Tosi, I get a lot of people like that, but usually it's on a background of people who have a tendency to have recurrent headaches. So sometimes for some company, they have screen protectors. For the hearing aids, I don't know how that can be solved. Maybe you muffle the noise, reduce the volume. Yeah, but it might not, you can't totally exclude listening on phones, especially if your job has something to do with customer service.
Okay. So those are things that one should be very much aware of, right?
Yes, please.
All right. Drug use or substance abuse, can that lead to headaches?
Yes. Substance use, drug use, combination of drugs.
Okay, just a second. Let me see if I take this call. Hello there.
Hello.
Yeah, good morning.
Hello, good morning, sir.
Raphael.
Yes, so the update of the earlier reported tipper truck that ran into the canal at counting over. I want to. Can you hear me?
Yeah, I can hear you.
Yeah, the evacuation is ongoing, but the 12 vehicles right here now cannot be able to evacuate the truck out of the canal. But we are expecting every vehicle that will be able to remove the truck from there. Okay. But aside from that, the movement is still friendly at this moment. This is counting inward excellence.
Right.
So the movement from Omole Junction inward excellence is still friendly, though it occupies about 60% of the road, but it's still having very good at this moment. Okay. And the return journey from excellence down to Ogba is still very good at this moment. Nothing to be worried about while waiting for the evacuation to be totally done.
All right then. Thank you so much, Raphael Jeramil. Of course, that impediment was reported earlier on. It's a tipper that ran into the canal there at County Inwards Excellence, and he says the crane that got there couldn't do the job, so they're requesting for a bigger one just to come and evacuate that. All right, so doctor, we're still talking headaches really. So we're talking about drug use and drug abuse. You said that can lead to...
Yes, and I need to add a little. So like I said, substance use, taking a lot of medication can lead to having recurrent headaches, and there's something called medication overuse headaches. Some people, when they have headaches frequently, they keep using paracetamol, diclofenac, tramadol, and all of those drugs. If they are used continuously 10 to 15 days in a month,
Right.
they could get to a stage in which the drugs are not working and they seem to bring on the headache. That's what you call medication overuse headaches. So it is not, like I said, it's not normal to have headaches all the time. That needs to be reviewed so that one won't tip themselves into medication overuse because they are using pain relievers frequently.
So if I find myself in that kind of web, for instance, and someone who's abusing drugs constantly, or for those who are listening to us right now, some have headaches and they're wondering, if they walk into a hospital, they come to RJOLAD, who should they request for? Who are they to see?
They should request to see the neurologist.
Okay. The neurologist. So neurologists will help us, right?
Yes.
Interpret what kind of headache I have.
Yes.
What if it's a case that maybe my headache is as a result of me, there's a kind of food I want to eat and I'm not getting it?
I will get the food for you and then they could go.
You mean it? Food in the form of drugs?
Food in the form of drugs.
All right, there's a message here. It says, good morning, Dr. Olusanya. What kind of tests do you recommend for someone with frequent unexplained headaches? David is sending that one. Do you have that kind of situation, unexplained headaches?
Yes. So for everybody with headaches, you want to evaluate fully. And some of the things you want to, yes, you might have at the back of your mind that you might be dealing with a tension headache, migraine headaches. But if you examine the patient and you are seeing some abnormalities, you might want to request for a brain imaging, typically a brain MRI, sometimes a brain CT scan, to be able to answer the question. There are other tests that can be done, but one of the major things you want to do is you want to have a look at that brain. What does it look like? If you take the picture and it guides you on the next line of action.
All right, this one says, my teenage daughter gets severe headaches during her periods. Is that normal? Ife is sending this one. Ife, thank you so much.
Thank you, Ife Oluwayazum.
I assume so too.
Yes, it is not normal. It could be menstrual migraine, and let's see, there are ways this can be addressed.
Okay, there's also menstrual migraine?
Yes.
Hormonal
changes, hormonal fluctuations are known to either worsen or improve headaches for some people.
All right. Anyway, I think I'll get you in some other day so you can expatiate more on all these types of headaches because, like we say, it's very, very common. And you've said it this morning that at least over 98% of patients that show up in clinics, right, they often tend to come down with headaches. Is that correct?
Over 98% of the population have had headaches one time or the other. You can hardly meet someone who has never had headaches in their life. I've seen one. In my entire practice.
Wow, only one.
Only one.
No headaches at all.
Everyone has headaches at some point in their lives.
Yeah,
the people who have never had headaches, maybe less than 1%.
Yeah, so, and this one's probably rare species, right?
Yes, rare species.
Maybe people like me.
Oh, really?
That's not very true. I'm just putting the legs. Okay, so RJOLAD, what do you guys do as it relates to headaches? How do you treat it?
Okay, so when you come in, you request to see the neurologist. When I see you, we take a history, examine you, request for some investigation, including brain imaging most times. Then, based on what we are seeing, we'll start you on treatment. We request for follow-up and we take it up from there. But I want to add, sometimes, like I said, headaches are treatable. So I see a few people who come to the clinic today, they start the medication, some get better, some don't get better, but they disappear. Then they come after 6 months. The drug did work. And I'm like, did we finish evaluation? So it's important you go for follow-up assessment so that we can make a tidy diagnosis. I had a very bad experience once. This patient came to my clinic, that was several years ago, had headaches that looked like a brain tumor. So we requested for a brain imaging. Right. I think the patient went away, came back several years later, about 2-3 years later, with the brain MRI I requested for then, and it was showing a brain tumor. It was really sad. And the first question I asked was, didn't we request for a brain imaging? They said yes, but there was no money.
So it could have been corrected then?
Yes, maybe. But
brain tumors, are they cancers?
Some of them could be cancerous. Some of them might not be cancerous.
So it can just be removed?
Yes, some can be removed without any serious sequelae.
So what was the final story on that patient? I hope he didn't lose his life.
I don't know. I referred to neurosurgery because at that point it was out of my hands.
Wow. Anyway, it appears for those that come across doctors like you, perhaps your smile alone might just heal the headache, right?
Thank you.
Let's begin to wrap this up. So what's your message to our listeners?
So my message is headaches might not just be simple pain as related to stress. It might not always be malaria and the so-called typhoid. If you're having frequent headaches, if you're having a very bad headache, sudden severe headaches, please come in early so that we can evaluate you and get you treated.
All right. So RJOLAD Hospital, they can always come. Where are you guys located?
At 21 Akindele Street, Kwagada.
All right,
Lagos.
then you can visit RJOLAD, and of course, you can also check them out on their website www.rjolad.com, or you can send an email to wecare@rjolad.com, or you can also call 0700 756523, right?
Yes.
07,000 756523. Dr. Olusanya, it's always nice to have you in the building. Thank you so much for being here.
Thank you, Victor.
Okay, then we're going to switch gears now. And of course, next up, we'll still be touching base with health as we dwell a bit on sarcoma cancer. But that will be after this time out.
Hello, everyone. This is